Brett Rocketer's fiance isn't feeling well. Fearing she had COVID, he took her to the ER at Mount Carmel Grove City Thursday morning around 7 o'clock.
I've never been in a war before, but that's what it seemed like in there.
Rocketer estimates about 40 or 50 people were in the waiting room. Some of them, he said, seemed very sick.
There was a guy out in the lobby just throwing up terribly bad.
After waiting about 6 hours, Rocketer says he and his fiancée left without help, then came back later in the afternoon. They left again around 9:30 p.m.
We had a nurse take her into one of the offices and swab her for COVID is the only reason we know she doesn't have COVID.
Because of the stress COVID-19 has placed on local hospitals, it is not unusual for patients to experience longer than normal wait times in emergency rooms, said part of a statement from Mount Carmel to NBC4, urging people to seek COVID tests and care for non-severe and non-life-threatening conditions elsewhere. But this story isn't just about Mount Carmel.
I feel like I've seen some people in some of our ERs have been waiting 8 to 9 hours to be seen for care.
Dr. Erica Kuby is an emergency physician who works in ERs across the Ohio health system. She says as inpatient hospital beds fill up, it's creating a backlog in the emergency room.
We're having trouble seeing the patients in the emergency departments because there's just no space to see them. And it just seems that there are a lot of sick people that need care, and we are just having trouble getting to them at times because there's so many patients and so hard to get them admitted to the hospital because there aren't beds available there.
While not everyone is showing up sick with COVID, Kuby says, it's still a big part of the equation. And as temperatures dip during the winter months,
Things are going to get rough in the next several weeks to months, and we need to take care of each other the best we can.